are in the right place. If you want to learn more about this round of the Ready by 5 Early Childhood Millage funding for next year, 2023, my name is Jill Salisbury. If you aren't talking, we'd ask that you please mute yourself. Cameras can be on or off, whatever your preference. Next slide, please. I'd like to introduce our Ready by 5 team. Starting from top left is Kyle Johnson, our funding administrator. Heather Boswell is vice president of First Steps. Katy Cortez is our financial accountant and interim president. Evan Heil, our data outcomes coordinator. Christine Timble-Larson is not with us today. She's our senior funding administrator. Megan Strang is our communications director, and I'm Jill Salisbury, your fund development and project manager. Next slide. Just a couple things. We're going to ask that you, in just a second, we're going to put a link in the chat for you to sign in. It's going to take you to a Survey Monkey form that you can complete, just so we can kind of keep track of those who attended today. We appreciate that you're with us. There it is. Thanks, Megan. And then a couple other housekeeping things. If you have any questions during the presentation, please use the chat. We're going to answer as many questions as we can towards the end of our presentation. And then all the questions and answers will be compiled in one document, and that will be available to everyone starting next Friday, the 22nd. Just a reminder, you saw that our session is being recorded. And then the RFP documents that you're going to want to see are on our First Steps website. That's firststepskent.org. If you go to the top right, the Millage tab, then under Funding Opportunities, and all of it is going to be available through EC Impact. Some of you are familiar with that. And if you're not, we're going to help you today get familiar with that. All the RFPs will be submitted electronically using EC Impact. That's my part. I'm going to turn it over to Heather. Next slide.
Thanks, Jill. Good morning, everybody. We're just going to take you through some of the more policy and requirement type pieces, just so everybody's aware of the requirements that come along with the Ready by 5 Early Childhood Millage. A little bit of history in case you are new to our Ready by 5 meetings. This came from a ballot measure that passed on November 6th of 2018 and was passed by Kent County voters for a 0.25 millage over 6 years to provide dedicated and sustainable funding for programs that improve the health, school readiness, and well-being of children ages 0 through 5 and expecting parents. So the general goals of funding are to help expectant parents and parents of young children navigate healthcare and other community resources, provide developmental screenings and individualized support to children with identified delays, disabilities, or emotional concerns, provide in-home or community-based supports to families to improve their children's health and well-being, and also addresses the bond between parents and their children, as well as provide early learning experiences to improve children's emotional and intellectual skills, and impart knowledge and skills to parents and other adult caregivers. So next slide. So we're just going to spend a moment and talk through what First Steps Kent is responsible for in this role as the Ready by 5 Millage Administrator. This is some of the language that comes directly from our contract that we have in place with Kent County. First Steps Kent is responsible for the development, coordination, implementation, and administration of the millage service delivery system. And this includes activities such as an open and competitive proposal funding allocation process for service providers to apply. So welcome to that process. It's starting for 2023 today. The establishment of a resident proposal review board to make recommendations. And a little bit more about this resident proposal review board. This is the community board that is responsible for reviewing proposals submitted. So any proposal that you submit in this round will be reviewed by this board. They are responsible for making recommendations for what proposals should be funded and by how much. So this is a 9-person board made up of 2 appointed county commissioners, 1 county administrative staff person, a First Steps Kent board or commission member, an early childhood expert, and 4 parents of children ages 0 through 5 living throughout different communities in Kent County. Other responsibilities that First Steps have include insurance that service options are readily available to individuals seeking services, outreach efforts designed to educate the community regarding available services are happening, that we're promoting participation in receiving funding by service providers, that an early childhood community needs assessment is conducted every 2 years. We oversee contract and financial administration of the funds, and service provider quality assurance through annual monitoring and regular reporting. Next slide. So as an agency that's receiving millage funds, there are specific requirements for the recipients of the funding as well. This is from the proposing agency agreement that you will find as a part of the RFP process. A few requirements that we'll take a moment to call out. That proposing agencies must possess the potential ability to perform successfully under the terms and conditions set forth in the RFP. Consideration shall be given to matters such as proposing agency's integrity, record of past performance, and financial and technical resources. The proposing agency must meet all financial requirements outlined in the RFP. And First Steps Kent reserves the right to reject any proposal if the evidence submitted by or investigation of such proposing agency fails to satisfy First Steps Kent. So I encourage you to review the agreement that's included in the RFP process for all provisions that are part of any proposal submitted for consideration. Next slide. We also want agencies that are applying for these funds to consider that millage funds are taxpayer dollars and are different than private philanthropic dollars. So they cannot be used to purchase property or equipment unless this is specified in the RFP, which you will find an RFP where this is specified this round. The services that this millage funds are for children ages birth through 5 years of age and expecting parents that live in Kent County. The funding is designed to cover the cost of direct services and reasonable administrative costs. Funds must be used in the year that they are awarded, so they cannot carry over to another fiscal year. And funds cannot be used to purchase equipment and property, again, unless it's specified in the RFP. So other things to consider as an organization funded by the millage, organizations cannot advertise services as free or no cost. As we mentioned, there is a cost, and the cost is to the taxpayers of Kent County. Millage funds will not supplant existing private foundation or other philanthropic funds, as well as state, local, and or federal funds already in use by the proposing agency that are supporting services. And the proposing agency agrees to seek other sources of funding in addition to Ready by 5 millage funding. So this could include grants and other philanthropic sources. Donations is something that we encourage. cost sharing, if this is applicable to your program category. We'll get into that a little bit more. And there's an entire section in the Ready by 5 service provider manual that we encourage everybody to review as they are applying. Next slide. And there are reporting requirements. So invoices for payment are submitted monthly through an online system. The child or expectant parent data is submitted monthly. This is submitted to the Kent County Health Department through a very specific file format that is defined in the Ready by 5 standardized data definitions. And this also requires that agencies sign a data agreement with First Steps Kent and Kent County Health Department. There's also program-specific outcomes and updates that are submitted on a quarterly schedule as well. So we mentioned the Ready by 5 service provider manual. This is a very comprehensive document that gets into all the details around programming requirements, some that we touched on here, and all the additional details as well. It gets into the financial requirements, reporting requirements, organizational requirements, and also provides a description of service and program categories. And this is available on the First Steps Kent website. So with that, I am going to kick it over to Kyle, who will start taking us through the request for proposal overview.
Good morning, everyone. As Heather stated, I am Kyle. I'm going to take you through some of the requests for proposal overview sections, and all our materials are available on our website, so they will be under the 2023 funding section. And it looks like Megan just put that link in the chat. So we can go on to the next slide. So the request for proposal or the RFP contents, they all have the same type of sections, but please pay attention to section number 2. That is where your scoring evaluation will be contained. So please pay attention to those. And then we're going to go over each section of the RFP in the following slides. So we can go on to section 1. So for this round of funding, the estimated totals of, available for this next round of funding is going to be around 1.6 million. That is projected. The amounts are contingent on the actual Kent County tax capture, and they are subject to appropriation by the Kent County Board of Commissioners each fiscal year. And contracts will begin January 1st, 2023 and continue through December 31st, 2023, unless otherwise specified. For example, the technology RFP is January 1 to September 30th. And we can go on to the next slide. And this is about our reimbursement structure. So services will vary. All services will be paid on a reimbursement structure, and they may vary by service and program category. So depending on which RFP you apply for, it'll be either an actual cost reimbursement. So that is when a service provider is reimbursed for the actual expenses incurred each month, or it'll be a defined rate. And so this is when a service provider is reimbursed per service delivered, and the amount reimbursed is set by a fee schedule that is submitted with the proposal. And reimbursements will only be for the actual reasonable and allowable costs of programming, and terms will be specified. Those are in the service provider manual. And select services will also be eligible for additional milestone payments. And we can go on to the next slide and talk a little bit more about those. So the service and program type that are eligible for this option, the milestone payments are going to be RFP number 1. Those are our healthy development program types. And payments for this procurement will come in the form of 2 types of payments. So the reimbursement payments, and that is when the service is provided and invoiced each month. And there's also milestone payments, which will be based on to the extent to which the provider is able to achieve predetermined programmatic milestones that are consistent with quality implementation and fidelity to its model. And those are more defined in the contracting process. So if you're going for those, you'll kind of figure those out once you start the contracting process. And now we can go on to how performance will be tracked. So performance is tracked through 3 key program metrics. Those are number of individuals to be served, number of encounters to be completed, and actual program costs. So to define all those 3, the individuals served, that is going to be the number of people served in the program. The number of encounters, these are units that show if individuals served are receiving an impactful level of service. So these numbers, again, will be confirmed during the contracting process if you are awarded funding. And we can go to the next slide to talk a little bit more about how performance will be tracked. So for your proposal, you should estimate the number of unique individuals your program will serve that meet the Ready by 5 eligibility criteria. This number will be entered in section 1 under individuals served. So persons that can be funded by Ready by 5 are children through the age of 5 and expecting parents. And also, you will estimate the number of contacts or sessions your program will provide to children through the age of 5 and expecting parents. And this number will be entered in section 1 for encounters. So those are kind of the 2 types of numbers you should be thinking about when developing your program application. And now we're going to go on to some performance trackers. We track performance 3 ways based on encounters, individuals served, and spending. So this first tracker is encounter units. These will not be used for invoicing, but these are tracked as part of your contract monitoring process. Actual encounters will be compared to projected number of encounters per individual served, stated in the service provider agreement. And those numbers of encounters will be confirmed during the contracting process, like I said earlier. And service providers will be required to explain why and if there is a deviation in the amount of 10% or greater. So pay attention to this quick little formula we have here. So to get the percent of encounters completed, you would just take the actual total encounters to date, and then you would divide that by the total projected encounters. So we can go on to performance tracker number 2. These are individuals served. So like encounters, these are actual numbers of individuals served, and they will be compared to the projected amount served. And so if this is greater than 10% or 10% less or greater than where you are in a point of time, let's say during the quarterly reports, you would provide a narrative to kind of contextualize why that number is either greater or lower than 10%. So just like encounters, you would kind of do this quick calculation of actual individuals served to date over or divided by projected served to date. And then as a note, these are just applicable to contracts that are not in the kind of defined rate structure. So these are more the programmatic ones. Sorry about that. We can go back to the next slide, our performance tracker 3, which is spending. So the actual spending will be compared to the projected budget using what we call the 1/12 estimate per month. So we take your total yearly allocation divided by 12, and then we can kind of estimate an average of what you should be spending per month. So we, First Steps Kent will estimate spending for January to June as follows. So like I said, we'll get the total annual award divided by 12. That gets your monthly average. And then your monthly average times 6 months is going to be what your kind of the first 6 months will look like. So like encounters and individuals served, if the service provider is 10% lesser or greater, you'll have to provide some a narrative as to why that is happening. And this is applicable to all contracts, either defined rate or actual reimbursement. So just take a note of that. And we can move on to the good stuff, which is how you're going to apply in EC Impact. So this round of funding, it is open to returning agencies who have applied last year through EC Impact. So if you're already kind of a veteran of EC Impact, you'll be able to apply, just as seamlessly as you've done all the other things in EC Impact. And also new agencies who have not applied through EC Impact, they are available to register and apply for these rounds of funding too. So we have updated the EC Impact training manual that is on our website. And as a note, this year, you will have to register for whatever funding opportunity you are going to apply for. So when you first kind of log into the application, you'll have to select which program you're applying for. And then we have to, on the back end, assign you to that program form set. So once you register and apply to each funding opportunity, we will assign you to the correct forms. And that should take less than 1 business day, but you're allowed to apply for as many opportunities as you want. And if you are applying for more than one opportunity, you have to submit them all at once. So be sure information for all the proposals is complete before hitting submit. And we should have a URL in the chat to go to our agency site. So Megan, if you could pop that in as well. The applications are not open as of yet, but they will be after this pre-conference. And we can go to the next slide. So the application is kind of set up in two kind of levels of forms. There's your agency level information, and this is required for all RFP proposals. And this is going to be broken down by a couple sections that you will fill out. So we can go to the next slide to talk about those sections of the agency level information. One section is your agency staff and leadership diversity. So you will click on this link and fill out this information. So this is, you just do it one time per agency, and that covers all of your submitted programs. So you will fill out your agency's leadership and staff kind of break down by ethnicity and race. And so just make sure that the totals match on those 2 rows. Just pay attention to those numbers. So that is done on the agency level. So you'll just do that once. And then also what you will be doing once is completing a few attachments. So these are called attachment B and C. These are attached right within the form. So you can just click it as a PDF, fill it out, and then attach it back. And so this is, again, on an agency level, you'll just do this once. And this agreement must be signed by the executive director, president, or CEO, and the board chairperson of your organization. So an uploaded PDF version of both documents must be included, like I said. And then the last section of agency level information is your required attachments. So these are broken down by 3 letters of recommendation. These are agency level recommendations, not program specific. So please take a note of that. And then also you must bind all 3 letters of recommendation in one PDF file. So also, in addition to the letters of recommendation, you will attach your most recent audited financials, and then also your organizational chart. And then we also have an opportunity for you to attach an agency annual report, but that is optional. So we can go on to the next slide and we can talk about the types of RFP opportunities. So we have 5 separate funding opportunities this round. Only one program type may be selected for each proposal submitted. And then, so for example, if you're doing 2 healthy developments, you have to do 2 proposals. That's basically what that means. And so agencies may apply for more than one opportunity. So you can apply to one or to all if you choose. So I'm going to briefly go through them quickly. So we have healthy development. And so we have the 4 categories under that, the healthy development service type. We'll get into all of those in a second. We also have another a couple more healthy development RFPs, and those are the Fetal Infant Mortality Review Network Lead Agency, and also the Ready by 5 Network Training and Education Leader, and that is new this year. We also have a Parent Education and Support RFP, and that is for translation interpretation services. And we also have a Technology Equipment Request RFP, and that is for all Ready by 5 funded agencies and for all service types. So we can go on the next slide, and where we can talk about our first RFP, which is healthy development. If you are applying for this RFP, you will choose one of the following 4 program category types, and those are healthy, expectant, and new parents, developmental and social emotional screenings and connections, healthy and safe home environment, and niche parenting support. That is new this year. So you can apply for more than one, but they have to be separate proposals, like I said. So
Thank you, Kyle. Do you want me to take it from here?
oh, sure. I'm sorry, Heather. I just kept
Okay.
going and going. I apologize.
I wanted to mention too, within each of these, Megan, if you could put the link to the RFP in the chat. There are very specific specifications under each of these 4 categories. So I just wanted to draw your attention to that RFP, and within the healthy development RFP 1, there's these subcategories that get into more detail for each of these. So you'll see a little bit of difference and what they are working to get at and how they're a little bit different, a few different goals and specifics in terms of each type of programming. But what they all have in common is that healthy development programming will follow evidence-based or evidence-informed practices that demonstrate success in supporting positive health behaviors that drive those better health-related outcomes for young children and expectant parents. We also want to make very clear that home visiting proposals will not be considered under this category. So this is for other health-focused type programming that meet the specifications in the 4 areas: the healthy, expectant, new parents, and other areas. So next slide. As far as the EC impact piece, we'll walk through some of the pieces and parts that are part of the application as you're thinking about your proposal. We had touched on this a little bit earlier in the presentation, the encounter type. So for the purposes of the proposal, we're going to be asking you to select an encounter type. We'll work with you through the contracting process to determine how many encounters. There's a lot of considerations with that, but for the purposes today, we'll just need you to determine if you are providing a group service, and we've provided some definitions here, or a direct service, a one-on-one service serving one child or expectant mother or expectant parent from a household. There is a third type of encounter, which is indirect service, and I'm willing to bet that the majority of healthy development services that are applying will not qualify for this. As far as RFP 1, it's purely for services that do not provide direct services to children or expecting parents. You will see that this is how the Fetal Infant Mortality Review Network RFP works. So that would be an RFP that would apply under this indirect. The majority of other services would apply under the group or direct, individual direct services. So next slide, individual served. This is something that we will be requesting in the proposal process. And we're asking for a specific format as far as how this is submitted. When you submit your number of individuals, we ask that you begin at 0, completely understanding that you are probably, if you are receiving funding, you're probably already serving families, but January 1, we'll start at 0. You'll let us know how many individuals you intend to serve in the first 6 months, and then you'll let us know how many individuals you intend to serve in the full 12 months. So we give this example of, in the first 6 months, this program said that they're going to serve 20 children. And then starting July 1 through the end of the year, they're going to serve an additional 30 children. But for that full year, that means that they're serving 50 children. The next slide. And we give a little more specification around individuals served to help figure out how to count. It's surprising how complicated it can get when you're counting individuals served. So what if there's more than one child in a family served? Your number of individuals served is based on the encounter type selected. So if you are selecting that direct service, that one-on-one encounter, you would have only one target per household recorded. This would be different. So for example, if you were providing counseling services and you had a 3-year-old child and you had a 4-year-old child from the same household enrolled in services, you could count them separately because they're each receiving a one-on-one service. The group encounter is different because you could have that 3-year-old child and that 4-year-old child attending a group or a session, and you would count them both. You're just counting the number of kids, the number of heads that you're going to have in each session, and regardless of household. And again, that 15-minute unit, that would be for RFPs that are not providing any direct services. The other thing we want to clarify is that you should not count parents and children from the same family in your count. So if a mom and a child both attend a group encounter, you should only count the child. The only time you're counting parents in your counts is if they are expecting parents. Next slide. The other thing to consider with this number is you're putting this number together in your proposal. We ask that you be realistic. We know that there's models that are, supposed to serve a certain way, but also realize that, I don't know, life isn't always blue skies. So as you're putting this number together, consider what has happened in your model previously. How many have you actually served historically? And look at that number as you're considering the number that you're putting in your proposal this round. Also, the reality of it is, are there still these residual effects from COVID-19 pandemic that are affecting enrollment? So we'll ask you to consider that. And it might be that enrollment's going to jump here too, because we're finding that, life is beginning to return a little more to normal as the year goes on. The other thing to consider, what partnerships or relationships would you have to establish to recruit this number? Is it already a current relationship, or is this something that you need to put in place? Some of the snags that we have found in numbers is folks have anticipated having a relationship that wasn't fully established, and it didn't work out the way that they thought it would. So just, kind of consider how well established a referral network is as you're thinking about your recruitment numbers for individuals served. And also, is this a new or expanded program? Will you need ramp up time to get the word out about your program and let folks know that you're open for business? And and all that type of marketing and communication. So again, we touched on this. Don't count parents and children from the same house, from the same family in your count. So you're either serving a child or expectant parent. And if you are proposing an indirect service, you would put 0 in these fields. So the next form in EC Impact, it's around result indicators. Many of you know that in 2021, a third-party evaluation of Ready by 5 began. So these are the specific indicators that link each of the programs that are funded by Ready by 5 to this evaluation process. So everybody must meet at least one evaluation indicator. And you will select the relevant indicators for each proposal submitted. Next slide. Also in this section, you will see what we call the program-specific SMART goals. This section is pertinent to your program. We realize that how the evaluation is working is it's a little more high level versus all the amazing things that are happening in programs and the goals and the the things that are being achieved program by program. So this is the time to put some measurable goals that are specific to your program that allow your program to shine. We are asking that it be put in this SMART format though, so we can understand what is increasing, what the program is seeking to change, how it's seeking to change it, and how you're going to track that or be able to show that with data or what other source of information that you may have access to. So it's a Mad Lib type template that will actually appear in the application where you will fill out these goals. Also want to mention that these are the goals that you'll be reporting on in your quarterly report. So you will see them, if you're funded, you'll see them pop up again, and you'll be expected to let us know where things are with each of the goals. For the purpose of this presentation, we put together some examples of SMART goals, and you can see that the first example, we've got the increase, we've got a program that will increase, and what they will increase is the number of families reporting positive parenting practices. How they will do this through families completing 12 home visits annually. And this will be tracked by families completing the Piccolo tool. So there's a couple other examples in here that will hopefully help kind of spark the thought process as you're thinking about how your goals fit into this format. Next slide. So you'll see a form also about partnering organizations. So this is getting at who your agency will have former partnerships in place with. And we're defining formal as you'll have a written agreement in place. We completely acknowledge that there are numerous relationships that, throughout the early childhood network. But we really want to get at where the formalized written relationships will be happening. Please let us know if this is a new or existing formal partnership. You'll let us know a description of the partnership, the purpose, and then also what will be exchanged in this partnership. Will there be an exchange of funds? In this case, if it's Ready by 5 millage funds, your partner would be a subcontractor under your contract, and we would need to know that. Exchange of data. So partner is expected to share client data. We would also need to know that too, because we would need to make sure that the client informed consent is being collected by all of your partners that are sharing data with you that's getting sent to us or to the Kent County Health Department. And then exchange of referrals is the other option that we're curious about. So the partner will support with referring individuals to this program. Next slide. So the next form that you will see in EC Impact, you'll need to be prepared to include the following information for each position that is funded through the Ready by 5 millage. We'll of course want the position title. We will want the FTE and percent of FTE. Please note, and you'll see this note in the application too, put this in a decibel format and it will make everything on the back end work better. Is this a new or current position? So if you are continuing funding, most of the time this will be a current position. Brief description of the position, and then we'll also want to know the total wages and fringe benefits for each position that's funded by Ready by 5. So if half of the position is funded by Ready by 5, we'll want to know how much is half of the position that the funds are covering. And this will be included in the budget form. So you'll see some connection between this form and the budget form. Next slide. So we put together this list as, you know, we've been through this process a couple times with partners, and things that we've heard that people may have not considered as they were putting together their numbers is things like required direct service time. You know, as they're considering the number of FTEs who will provide service, is there enough hours to serve all of the people that the proposal says that they're going to serve? Also considering that in that time, there should be professional development hours and training costs. There's of course holidays and paid time off. There may be seasonal work schedules that you'll want to consider. If your program does not run over the summer, you would want to consider that as you're figuring out your wages and your FTE. There may be no-show and cancellations as well that you'll want to account for. Time to attend meetings, time to complete the annual assessment process. Many of you have been through that process, and there's some documentation and other information that needs to be pulled for that process. Also, of course, you know, we're getting into our Department of Labor stuff, which most of you know this, required paid lunch breaks, drive time. You might want to consider if direct office space or workspace needs to be considered in your budget, and how much space. Time for documentation, data entry in that FTE. Does some of that time need to be set aside for those pieces? And also your scheduled mandatory staff retreats. And this is not a comprehensive list, but just as you're thinking about how many FTEs and how much of that FTE time should be included in your budget, some considerations to think about. Next slide. So with this process, we class expenses in a way where there are direct service, direct staff costs, and this is the staff that is providing the service. So it's the hands and hearts of the service, if you will, the individuals that are reaching families, you know, doing the counseling, doing the assessments, whatever your model is, it's the individuals that are doing the service. So those are the direct. We fully realize that there's a number of supports that need to be in place to make sure that that work can happen. But we class them all in a different way. So you'll see in the budget that there's direct, which would include, as I mentioned, the individuals that are doing the direct services. But in the indirect, we are including supervisors' time, data support time, scheduling and planning of direct staff time, your marketing communications time, financial staff time, administrative assistant supports, the time for team to do the development of agreements. So perhaps it might be partner agreements, going out and making arrangements and working out details. You can include leadership staff time to support annual assessments in there. And of course, your IT, HR, your backroom support staff time. We also want to draw your attention to that the president, executive director, CEO, executive leadership, whatever your leadership structure looks like, that time may be specifically included only if their time is dedicated to specific program activities. So next slide. One more thing, actually, I just want to mention about the indirect staff time too. Please look at that list and make sure that you have included enough time for each type of indirect staff that you need, particularly the data. There are quite some rigorous requirements in that area. So please take a look at those requirements if you are not familiar with them already, and make sure that you are dedicating enough staff time in that category for that work. So, okay, that's the only one I want to point out. Okay, next slide. So the budget, you'll see a format. It'll have your revenue section. So we're asking for all sources of program revenue. So if you're receiving a grant, if you're receiving donations, we just want to know that what all of your program revenue is. The expenses is a little bit different though. We only want the expenses that your requested Ready by 5 funding will be used for. We also, as we mentioned before, we want the FTEs that will be paid for with this funding itemized in the budget. And with the budget, please understand the requirements related to cost sharing for RFP1. You do need to consider this for your service, donations as well, and also look at the unallowable costs. Equipment cannot be included in RFP 1, 2, 3, and 4. And, hoping that you'll maybe take these slides and use them as a reference. You can go back and look as kind of some notes as you're going through the application process. Just some things to check before you submit in the budget form. Make sure that the requested amount in your revenue matches the total for all Ready by 5 expenses. So the amount that you're requesting matches the amount that you're spending for Ready by 5 millage funds. We mentioned it before, but please include the staff positions. So in your budget narrative, please make sure that you itemize all of those positions in your budget expense section. And then going back to your partnerships, if you listed any partners where funds would be exchanged, please make sure that those get itemized in your budget as well. So next slide, and this is kind of a summary. There's 10 steps we say to complete RFP 1, and you will find some of these forms also in the other RFP opportunities that we'll go through in a moment here. So you might come back and refer to these slides, particularly for the budget form, partnership form. You will see those in the other RFP funding areas. As you move through the forms, watch for the instructions in the light yellow boxes. And there's also hover boxes. If you see those question marks, if you hover over those, you'll see more context to the question being asked and more information that will hopefully be helpful in clarifying. Note the word limit for each section. Some sections are supposed to be brief and some are longer. And a few of the questions are linked. So depending if you answer yes or no, you'll see different questions appear on, depending on how you answer a previous question. And again, we encourage you to use these slides just as a reference and as a resource as you move through the application process. So once the budget is complete, you'll review and sign the certifications that Kyle had walked you through. You'll want to make sure that everything is complete, and you'll see on your dashboard in EC Impact, it's really nice. It'll show you if there is information that is not complete. And as mentioned, all of the RFPs, all of your proposals, so if you are doing multiple proposals, they'll be submitted at one time. So you want to make sure that everything is submitted, everything is complete before you hit that submit button. So with that, we've gone through a lot of information. We're going to give folks a chance to catch up on their notes, and we're just going to take a brief 5-minute break, and we will come back at 10 o'clock. If you have questions so far, feel free to enter them in the chat. We will be sure to address as many of the questions as we can at the end of this presentation, and we will see you at 10 o'clock.
Pedal to the metal. So just a few more seconds and then we'll start. All right, my computer says 10 o'clock, so I think we will get going once more. So Evan, if you could go to the next slide, we're going to go over the rest of the RFPs and the necessary forms you will be filling out in EC Impact. So request for proposal number 2 is our Healthy Development Fetal Infant Mortality Review Network Lead Agency. And this RFP, only one agency will be funded. And so the Fetal Infant Mortality Review Network, or FEMR, they are in place at the state level and in multiple counties across the state. We seek to reestablish this network in Kent County. The FEMR process rigorously reviews infant and fetal death cases to identify factors contributing to infant deaths and develop action-oriented recommendations to eliminate fetal and infant deaths in Kent County. And so additional specifications for this RFP is you will be reporting quarterly to Kent County's Early Childhood Network, and also you'll provide an annual summary. And we can go on to the next slide. And so if you are applying for this RFP, you will fill out the following EC Impact forms. So you will fill out a narrative, the budget narrative, and see directions provided in RFP1 slides. You will also fill out a budget and proposal certifications. So those are the forms you'll be filling out in EC Impact for that specific RFP. So we can go on to RFP number 3. This is the Healthy Development Ready by 5 Network Training and Education Lead. These are trainings for all direct service professionals funded by the Ready by 5 and their direct supervisors. Training topics will address the following areas. So we have responding to family needs with a trauma-informed approach, secondary trauma, resources for professionals. There's also domestic violence and family safety, how to respond and support families with young children. We also have increased education on safe sleep for caregivers and family members to improve training and education. And finally, quality program practices to improve services to families with young children. And we anticipate that 3 proposals will be selected for this RFP, and also agencies demonstrating experience and expertise in multiple areas may present training and may apply for more than one training area. So keep that in mind. We can go on to the forms you will be filling out in EC Impact. So like we said, this is a RFP that you will be providing a fee schedule. And so you will, instead of filling out a budget, you'll provide a fee for service. You'll also be filling out training area narratives, depending on how many you apply for. You'll be filling out a partnering organization form, proposal certification, and a budget form. So with this budget and the following 2 RFPs, you'll just fill out one line in the budget, and you'll see that in the last section of the budget, just your total program, your total, but essentially. So like I said, this is a defined rate contract. And so the service provider is reimbursed per service delivered, and the amount reimbursed is set by that fee schedule I mentioned earlier, and which you'll be submitting. So we can go on to RFP 4. This is the Parent Support Translation and Interpretation Services. This will be multiple awards. So all current Ready by 5 funded programs will be eligible to request interpretation and translation services, and the cost will be covered by this source of millage funding. So this request for proposal, we seek agencies who are experienced with providing translation and interpretation services in one or more of the following formats. So face-to-face, from English to another language, or vice versa, over the phone or in video interpretation, document translation, English to another language, and also 1 hour in services for requesting agencies and their staff to learn about cultural considerations as they serve families through translation services. So that's more of a training element within this RFP. And we can go to the forms you'll be filling out. So you will fill out a narrative as well as a fee schedule. You'll also attach language certification and a license list, and not listed here, but you'll also attach a program staff and organizational chart, specifying duties and whatnot. And then you'll also fill out a budget, but like the previous RFP, just that one line total at the bottom of the budget, you'll see where it says where you need to put that in. And you'll also fill out a proposal certification form, and like the training RFP, this is a defined rate contract, so it's reimbursed per service delivered. And lastly, we can go on to RFP number 5, and this is a technology request. So this is a one-time funding request for technology necessary to support staff positions funded by the Ready by 5 millage with current or upcoming contracts that continue through December 31st, 2023. So this request is for totals exceeding the threshold defined in the Ready by 5 service provider manual. And those include purchases of property costing more than $1,000 per unit, and technology equipment to include with those. So like, complementary hardware like a monitor or keyboard. So things that cost more than $1,000. This area covers technology costs only. So funds will not be covered for program expenses, staff costs, or indirect costs. You cannot seek funding for those elements of the equipment. And so please see RFP section 2 for the complete requirements. And we can go into the forms you'll be filling out. You'll be filling out a narrative for the technology equipment request. Also, you'll be filling out a technology equipment request form. So for each piece of technology, you will fill out a form and some questions per request. You'll also fill out that one budget line total and proposal certifications. And so this area only covers technology related equipment costs. Requests for funds to cover additional program expenses, staffing costs, or indirect costs will not be considered under this funding opportunity, like I said earlier. We can go on to the next slide. So this slide is covering EC Impact technical questions. So if you're having any issues registering or any specific EC Impact questions or concerns or issues, you can reach out at our email. So if you're having any of those technical issues, please email readyby5kent@firststeps.com. firststepskent.org. And just as a note, we can assist with questions and issues specifically related to the EC Impact online application process. So just those very technical questions. We are unable to answer questions related to the RFP unless they are submitted through the written process as described in the RFP documents. And we'll get to that in a second. So any questions with the actual EC Impact process, please email us and we can get you an answer. We can go on to the next slide, which is our question and answer period. So this is where you'll be requesting any sort of clarification or interpretations of the RFP, and they must be made in writing by July 29th, 2022 by 5 p.m. This is a firm deadline, so no questions will be accepted after this period, and links to the questions will be posted on our website. And so this kind of differs than from the technical questions we had in the previous slide. So this is clarifications of the RFP. And Megan just put something in the chat for you to review. And we will provide all final answers and notifications of amendments to the RFP no later than August 5, 2022. And they'll be on our website in the 2023 funding landing page. And I just want to note, it is the respondent's sole responsibility to monitor all inquiries, including those submitted by other agencies and published by First Steps Kent, to properly prepare the proposal for submission. So be sure to look at those Q&As because someone else might ask a question that you may have not considered or are thinking about yourself. So we can go on to the next slide. So here is a timeline. This is a tentative timeline. It is subject to change. So here we are today, July 13th. So the RFP is issued and posted to our website. You are currently in pre-conference number 1. We have another one tomorrow afternoon, which will be the same thing as we did today, just for folks that can't get to this one or want to see us and hear us again. And then on July 29th, the question and answer period closes at 5 p.m. So please make sure to get your questions in before then. We will post all final questions and revisions to the RFP, if necessary, to our website on August 5th. And then the 26th of August, 2022, the proposal submittal deadline occurs at 1 p.m. So this is a firm deadline. So please make sure you're submitting any of those proposals by August 26th at 1 p.m. We can go on to the next slide. And so this is some other things to note. The First Steps Kent will reach out by email to proposing agencies with questions and requested clarifications from the Resident Proposal Review Board. So that won't happen until September, but please be aware that questions can come to you and they will be emailed to the primary contact, whoever that is assigned an EC Impact. And so they should anticipate they will receive emails requiring an urgent response as the Resident Proposal Review Board meets during the dates of September 19th through September 23rd. And questions will only be sent, excuse me, by email to the individual listed as a primary contact in the agency profile. So just make sure you know who that primary contact is, and it is the appropriate person to receive those. So make sure they're not on vacation or anything. And then please double check the email and phone contact information for this individual is correct as you submit your proposal. All right, I think we can go to the next slide, which is questions. So I'm not sure if any questions if you have a question, please write it in the chat so we can include it in the Q&As, but you feel free to write that in the chat and then also, hop on and voice your question too. But we just want to make sure we have a list of those questions if you can. So anyone looking at the chat?
I'm looking, nothing yet. I think if you want to just ask questions too, Jill and I can record them.
Hi, this is Barbara Behrens from Vibrant Futures. I just had a quick question. I probably already know the answer to this, but with the technology RFP, with you're saying it's just for the equipment, so that does not include any of the tech service for installation and those types of costs if you are purchasing technology?
I can take that one. That's correct. The idea is that that could be included in your regular proposal. So this RFP is around the technology only covers those equipment pieces that cannot be purchased with the way that Ready by 5 millage funds were RFP'd out before.
Okay, great, thank you.
Hi, this is Shanae from Vibrant Futures. Sorry, I don't have a video right now. But I do have a question about whether or not we have a sense of how many folks are that you would be planning to serve in these educational areas. I mean, we have a whole education and training department. And so I'm just trying to get a sense of what the need might be.
So we can pull together a more exact number. I think when we did a very preliminary count, we counted like around 150, is that right, staff? But let us go into contracts and do a little more digging to just to double check that number. So that's the total, but that's all programs too. If you are doing something very specific, like for example, you know, maybe doing, I don't know, I'm just throwing something out there like play techniques, that may not be a training that's applicable to every program. So if you have more specific questions about what that universe would look like, so maybe you're doing something just in outreach and navigation, or you're doing something just in home visiting, throw that question in the Q&A and we'll see if we can get you a more exact number depending on who your target audience is in the network. Does that help?
Thank you.
Yep.
Great.
Looks like we had another question in the chat from Kate. Would early literacy programs be considered under Healthy Development Services for this round of funding? I believe the answer is no. Those would probably be coming out next year, as we did them last year. Correct me if I'm wrong, Heather, or anyone.
Yeah, and I think the important thing to also look at is the indicators under each of the RFP types. So under the 4 healthy development types, you'll see the very specific goals that each program type gets at. And consider that too, as you are reading through. If you see, you know, a way that your program kind of fits in the flavor and can meet those specific indicators, you know, that's something to consider too as you're looking through these.
Well, I think we can hang out for a few minutes if anyone has any questions that come to mind, but I just want to go over maybe some additional information as we close out. So Evan, if you want to just hop on to the next 2 slides, we can just go over we can just put the glossary up. And people just want to look at that too. So, but if you don't have any questions and you're all set, I think you are free to go, but we will, like I said, we'll hang out if any questions come to mind. So thank you for joining, everyone. Hope you got some information out of this.
Just want to mention too, we will post these slides and the recording of this presentation and Charles' presentation on our First Steps Kent website. So if you feel like you need to go back and look at stuff, you will find that information there.